Kate Tulenko. She's the founder and CEO of Corvus Health. Kate, thanks very much for your time. How concerned should we be about monkeypox?
I think the average person really shouldn't be concerned. The important message here is you should still protect yourself against COVID, and anything you do to protect yourself against COVID will protect you from monkeypox. So once again, social distancing, wearing masks, good hand hygiene, and avoiding high-risk situations. We're seeing that monkeypox tends to be transmitted in these clusters, which are events, parties, concerts, where large numbers of people are in very close contact for a number of hours, a type of situation, then they're going to be safe. I think if we hadn't also been in the middle of a pandemic with COVID, I don't think they would have declared this an emergency. I think the problem is this is happening at a time when people are just exhausted. Health workers are exhausted. And there's really not the resources to this. And so by declaring another public health emergency of international concern, it will unlock new funding that will help governments address this.
Now, when you talk about transmission, what are some of the ways in which monkeypox can be transferred? Is this similar in the way that coronavirus can be airborne for some time, be on surfaces and last for some time? How long can the virus be alive outside of the body? And what are some of the ways that it gets transmitted?
Well, it is airborne, but much less so than with COVID. So it does not hang around in the air. You have to be in very close contact with someone, like maybe in an elevator, but not, sort of passing through a room. So most people get it through contact, whether it's touching the person, clothing, bedding, or touching something else that they had touched. So once again, for the general public, there really isn't a need to be concerned. But we want to make it clear this is not a sexually transmitted disease in the way that people think of other STDs, such as gonorrhea or HIV/AIDS. Wearing a condom will not necessarily protect you because, if you're having sex with someone, you'll be in close enough proximity that you'll be in contact with their respiratory particles, and also in close enough proximity that you'll have that skin-to-skin contact. So this is not something that necessarily wearing a condom would prevent. But of course, we would remind people that any type of sex that's done with not a regular partner, that people should use protection.
There is an added layer of concern here, though, for the demographic that is predominantly affected by monkeypox, which is homosexual men. What risks are there in terms of these barriers that could potentially go up in terms of stigma and discrimination around these groups, in terms of trying to get help to those who need it most?
They're both the official risks and the unofficial risks. In some countries, homosexuality is unfortunately still illegal. So people could be jailed. It could affect their careers, affect their families, and also sort of the unofficial risk is in some communities, people could be beaten. People could also be denied medical service, health service. So there really are quite some significant consequences here, and there are still some countries where homosexuality is a capital punishment, where people could be put to death.
And I suppose just even in the wider, demographics in the Western world too, there perhaps is an association and assumption around people with monkeypox that they might be from a particular type of sexuality too. So there's a sort of several layers to this issue that would bleed, no doubt, into the Western world too. Now, in terms of inoculation, why has the world not caught up to vaccinating and ensuring there's enough vaccines for people to use, given that that's, it's a disease that's been around for a long time now, particularly in Africa? Why have Western scientists not caught up with the African researchers to make sure that there are enough vaccines to go around should there be an outbreak like this?
Well, the reason is because we eradicated smallpox. And so really anyone born after 1975 has not been vaccinated against smallpox. And so they're because there's sort of a cross reaction there. And so as a result, you have large populations of basically anyone who's 50 or 45 and younger who is vulnerable to both smallpox and to monkeypox. And so it was never seen as a priority to come up with a separate vaccine. I don't think you would need to. And It was also never seen as a priority to vaccinate populations in West Africa against monkeypox, because there were always other diseases, such as HIV, malaria, TB, which were of much greater concern in killing far more people.
All right, Kate, thanks very much for your time. Kate Tulenko there, CEO of Corvus Health.